Hello people, in this video let us look at spermatogenesis. So this has been asked in the anatomy final exam for 5 marks. So spermatogenesis you should know as it comes under embryology. We are covering it under embryology PYQ. Okay. So basically spermatogenesis 5 marks means you have to explain a lot. So look at the diagram here. Overall this is what you'll have to say. The germ cell. Then you have the type B, okay, spermatogonium. This is the one that is giving rise to this primary spermatocyte, okay. And so this basically till here it was mitosis. Now it is meiosis that is happening. Meiosis, the first meiotic division is by the primary spermatocyte. The primary spermatocyte undergoes the first meiotic division, right, to give you the secondary spermatocyte, which then undergoes the second meiotic division, okay, to give you spermatids which are immature, and then they mature to become spermatozoa. So this maturation is called as spermiogenesis. So spermiogenesis is a part of spermatogenesis, okay. So overall I have just told you people, so basically you should understand that spermatogenesis is nothing but giving rise to the mature spermatozoa, okay, or the sperms, right? And when does this SPERMS, right, sperms, yeah. So when does this start? It starts at puberty. That's around 12 years, that is in a male. It starts at puberty and goes on for lifetime. So basically where does this happen? It happens in the testis, right? So basically you can see here this is a boy, male. So basically the testes is going to produce the sperms. And why does that happen? Because of the hypothalamus, which is telling the pituitary to release follicle stimulating hormone, which will enable the production of sperms, okay. So the hormones also you'll have to mention, that is FSH, okay. Then you have other hormones like LH and testosterone, etc., which help in the maturation of this sperms, okay. So you have to mention the hormones, you have to mention the glands, that is hypothalamus, pituitary, etc., okay. So where in the testis are these sperms produced? So basically the testes they are shown here. So in that you have the coiled seminiferous tubules, right? In these tubules, if you look at the cross section like this, see in the middle there is lumen, right? That is to where the sperms are actually released. So the sperms are produce something like this, They're produced from here and they move towards the lumen, okay, and they come out, correct? So this is the cross section they have shown you where the like this, the sperms are produced, whatever diagram you saw, right? So that you can directly see that here now. I'll zoom here. So you have the germ cell, the primary spermatocyte, which will undergo the first meiosis, right? To give the secondary spermatocyte, which is haploid. And then these become spermatids. And then those spermatids, via a process of spermiogenesis, they will mature to give you the spermatozoa, which is the sperm. These sperms, okay, will move to the epididymis and there they will gain the motility, okay. So like we said, in spermatogenesis you have both mitosis and meiosis, okay. This is what you have to mention. You have both mitosis and meiosis in spermatogenesis. So let me explain this again to you. So you have the primordial germ cell, which is giving you the type B spermatogonium. So there'll be a type A also, which is not of our concern here. So you can see the primordial germ cell giving you the type A and the type B. The type B is the one that is proceeding to give you the primary spermatocyte, which is the largest germ cell, it says, that is diploid. Then it will undergo the first meiotic division and then it will give you the secondary spermatocyte, right? Are you able to see? So the primary spermatocyte undergoes first meiotic division to give you the secondary spermatocytes, which undergo the second meiotic division to give you the spermatids, which will then undergo spermiogenesis, where it will develop such a beautiful shape you see, with the head, with a cap, and then with a tail and all that. So this is spermatozoa. You will have to draw the diagram and also mark from where it became haploid. So initially it was diploid. Then you have the primary spermatocyte. It will undergo the first meiosis. Then suddenly you have the haploids, right? Fine. So some extra information you will write that who is supporting these sperms? Who is supporting these sperms? They are the Nurse cells or the Sertoli cells. Sustentacular cells. Sertoli cells. Sustentacular cells. Or the name, they all are the same only. Okay. These are the ones that sustentacular. All same only. These will nurse the sperms. Sertoli cells. Okay. Okay, guys. So now let us say they had asked not spermatogenesis, but they had asked you spermiogenesis. So don't get confused in the exam. If they ask you spermiogenesis, it is a part of spermatogenesis itself. Nothing but the formation of this beautiful sperm from the spermatid. See the spermatids here. You have the haploid ones. They are maturing into the spermatozoa, which has this beautiful shape. They are also haploid. So how does that happen? That happens via the spermiogenesis. So spermiogenesis, what and all happens? This acrosomal cap is formed so that it will contain all the enzymes which will help it to penetrate the egg, right? Then you have the nucleus. So nucleus here, you will have the genetic material, right? Then you have the neck here, and then one mitochondria here, right? And then a beautiful tail here. So draw this diagram also if you want marks. So it will actually, what it will do, it will condense the nucleus. So the nucleus will get condensed. It will lose all cytoplasm, right? It will shed most of the cytoplasm. It will condense the nucleus. So that is where the genetic material is, right? Do you know that for this entire process, it takes 74 days? 74 days, okay? And how many sperms are made daily? Do you know? 300 million. This is what Langman says in his textbook. So 300 million sperms are produced daily. Sperm cells are produced daily. How many days does it take to make a sperm? 74 days. Let us say in the exam they actually ask you gametogenesis, okay? If they ask you gametogenesis, you will have to explain both spermatogenesis and oogenesis. Don't forget, okay? See, it is asked for 5 marks, so you can just write one line on clinical anatomy or clinical embryology at the end. So we actually do sperm count, right? We check the motility under microscope also. So the normal sperm count they are saying is greater than or equal to 20 million per milliliter. Okay? This much is enough to get 5 marks. Don't you think, people? See you in the next video. Bye-bye. Excellent, excellent. So now let us see if you can answer some MCQs, because even MCQ can come in the theory paper, remember. From one spermatocyte, how many sperms can you make? So you have a spermatocyte. How many sperms can you make? Answer seems 2, but interestingly the answer is 4. Okay. And this one is very important. The spermatozoa, right? It is having this acrosomal cap, right? Acrosome and all. From where is it coming? So the answer is Golgi body. Okay. The Golgi complex of the spermatid will form this acrosomal cap, acrosome of this sperm. So Golgi body, you have to remember. Golgi complex, you can say. Okay. So Golgi complex is very important in this spermiogenesis. Golgi complex, that word you should use. Okay.